A very good day to you, my name is Noraiza. I'm Esther Lau Jun Yi from Board 11. Today I'm going to present about drug abuse and use on stimulant, heroin, morphine, and pethidine. First of all, let's start with my table of contents. So that is introduction. I will talk about the definition of drug use and drug abuse, and also the types of drugs, and some statistics. And also, we have to understand the causes and the impacts of drug abuse on human. And to understand each drug better, I will talk a little bit more about on their definition, mechanism of action, how they affect human body, and some example, and also their short-term and long-term use. And then we will go into treatments and prevention, and lastly, conclusion. So as we know, drug use and abuse remain a very significant public health concern, not only in Malaysia but also around the world. That's not only affecting the individuals but also their family and our society. So these drugs, some of them are used therapeutically for pain relief or some medical conditions, but some can be misused and leads to addictions and also health complications and social consequences like violence or theft. So in this presentation, I will explore the concepts of drug use and abuse, and particularly we will focus on stimulants, heroin, morphine, and pethidine. So by the end of this assignment, we should be able to understand the effects, the medical applications, and potential dangers of these substances to prevent substance abuse related complications. So before I go further, let's understand first what is exactly means by drug use and drug abuse. So the very clear difference between these two is basically the strength, which is the dose of the substance of the medications and the frequency of the individual using it, and also the intention of consumption. So, for drug use, it refers to the appropriate or intended consumptions of substances, including medications like prescribed by doctors, and also recreational drugs. Like for example, of this recreational drug is some people will take alcohol occasionally, like when have party or something. So that is not considered as drug abuse. So in the other case, for drug abuse, is the use of illegal drugs or the use of prescription or over-the-counter drugs for non-medical reasons, which means they are using that drugs not because they have some medical condition that are causing them have to take the drugs, and also in excessive amounts. So in this case, they would consider as drug abuse. There are many different types of drugs that we can find. For example, depressants, which prescribed for patients who got anxiety, depressions, muscle spasms, or seizures, and also stimulants. This is prescribed to increase our level of alertness, our heart rate, blood pressure, or breathing. This might be prescribed for who's got ADHD, and also opioids are often prescribed to patients who are suffering from intense pain, such as post-operative pain. And also there are many others of drugs, such as inhalants, hallucinogens, and all. But today we'll focus on stimulants and opioids. So, based on National Anti-Drugs Agency (NADA) 2023, the drug abuses have been registered in Malaysia between January and March, which is only 3 months. It's a total amount of 103,760 people, which means that is a very big amount. So let's have a look on this statistic. It's a research on the types of drugs being abused between 2016 and 2020 in Malaysia. This is also obtained from NADA. We can see from the graph here, the most drugs being abused is opiates, which is opioids like morphine, codeine, pethidine, or those. So this statistic highlighted that Malaysia needs more awareness or intervention to prevent the increasing of the drug abuse case. So next, we move to the causes and impact of drug abuse. So before that, we should understand that Drug abuse can happen on anyone, no matter the ethnicity, the age, or the genders. So the question is, what are the risk factors that can increase such behavior? So first, we can look at this biological cause. It includes genetics, brain chemistry, or mental health disorders. So for genetics, for those who has a family history of drug abuse, they are more likely to have the same behavior. And brain chemistry, so in some case, doctor will prescribe medications such as opioids, morphines to relieve the patient's pain. But research says that one dose of opioids is able to cause addictions in some people, and also mental health disorders such as anxiety, depression, or psychosis will increase the likelihood of drug abuse. And second will be the psychological cause. So for people who feel stress or trauma, like they will have the intention to have to take the drugs to help them feel relaxed. And also for those who has low self-esteem, they will take the drugs to increase their confidence or avoid from the current situation. And also curiosity and experimentations. Next will be the social and environmental causes such as peer pressure. So the influence of the peer might increase the likelihood of drug abuse, and also family influence like the weak family connections and availability of drugs in the market. So what are the consequences of drug abuse? I divide it into three aspects, which is social, health, and economic. So for social, first one is family breakdown. The persons that taking drugs will start neglecting their own responsibilities as for example, students, husband, wife, father, or employee. They will start to neglect their own responsibilities, and also they might conduct domestic violence and cause emotional distress for family members. And this can further cause family and friends distance themselves from the person and cause the person to feel isolation and loneliness, which can further worsen the condition. And also, they might start conduct a criminal like thief or drug trafficking or violence in order to continue to get their drugs. And next will be the health issues. So drugs can cause not only physical health issues but also mental. So for physical health issues, we know drug is a very dangerous chemical. It can disrupt our brain function, our organs. So it can cause organ damage, cardiovascular problems, or respiratory depressions. For mental health issues, it can cause depression, anxiety, psychosis, such as bipolar, schizophrenia, because the drugs can disrupt our brain's chemicals, and also suicidal thought. For academic, those person who are taking drugs already cannot function normally in their life. So they might start to have poor work performance or poor performance in the school. So it can cause job loss or the person quit from the school, and cause financial strain because they have to spend a lot of amount on the drugs, and the drugs are normally usually very expensive in this case, and it can cause a lot of debt, poverty, or bankruptcy. And also it can increase the healthcare cost because they are more likely to share like the needles, and it can cause overdose, infection, health issue that will increase their cost on the healthcare, and the legal cost and imprisonment. So they might getting caught by the police officer and can cause fines or legal fees and loss of productivity in the societies. Then this will cause the decreased performance of the economic of the country. So now we start with the first class of drugs, which is stimulant. It is often prescribed by the doctors to increase a person's brain activity, enhancing alertness, attention, and energy. So for example of stimulant, we have two different groups, which is legal and illegal. So for legal, we have caffeine that we can find in our daily life from coffee and tea, and nicotine in cigarettes, and also the prescription stimulants such as Adderall and Ritalin. So these drugs can be prescribed to treat ADHD and narcolepsy. For illegal groups, we can see is cocaine and methamphetamine. So these two drugs can cause a very high addictions, and is still illegal. It's illegal to use in healthcare. So next, let's talk about the mechanism of action of stimulants. So basically, it will increases two hormones in the brain, which is dopamine and norepinephrine. So dopamine, also known as rewarding hormones, so it can cause the person to feel pleasure, motivations, and also norepinephrine it is the hormone that can cause our metabolic activity to increase. So we can have increased heart rate, blood pressure, and also it enhance our fight or flight response. So in this case, after the stimulant is used, the person will feel happy or excited or increase the blood pressure and all, and like very alert. So this drug abuse of stimulant can lead to dependence, and the brain will become reliant on the stimulant to function normally. So without the stimulant, the person who has drug abuse will feel no excitement, no feeling, no emotion at all. So if we look at the effects of stimulant use in the short term and long term effect, like what I say, the short term effects will be increased energy, alert, very focused. I feel very confident, and I might not feel hungry because I have increased energy. However, if I use it long term, it can cause addiction and dependence due to the changes in the brain chemistry. We will rely on the stimulants to have those natural hormone like dopamine and epinephrine, and also we'll have cardiovascular problems because the long-term increase of the heart rate or the blood pressure, so it can cause irregular heartbeats, and also can cause anxiety, paranoia, and psychosis. To the heroin. Next, so we move to the heroin. Is an illegal opioid drug derived from morphine. It binds to opioid receptor in the brain and leads to intense euphoria and pain relief. Euphoria, which is excessive excitement and happiness. So effects of heroin use for short term, like I mentioned just now, it can cause euphoria. However, it can cause drowsiness at the same time and relaxation feeling, pain relief, and slow breathing and heart rate. It's different from the stimulants because stimulants increase our system, increase everything, speed up everything. But heroin will suppress them. However, for long-term effects, it still can cause severe addictions due to its impact on the dopamine receptor, and can cause collapse veins due to the repeated injections, and liver kidney disease to remove all the toxins, increase risk of infectious disease. Next will be morphine. Is a natural opioid derived from the opium poppy plant, primarily used for severe pain relief in medical setting like post-operatives or pain and cancer pain. So next, so if effect of morphine use is similar like the previous one, the heroin. However, morphine can cause more severe long-term effects because the dose in the morphine is higher, is more pure. So for long-term effects, it can cause tolerance, which the person require higher doses for the same effects on like relieving pain, and also the physical and psychological addictions. So the person will feel loss of interest, trembling, shaking, and the withdrawal symptoms is very strong. We'll talk about this later. And the respiratory depression, like slow breathing, the risk of overdose is increasing. Next, we move to another opioid, which is Pethidine, is a synthetic opioid used for moderate to severe pain relief. It's often used in labor pain or post-op pain. So effect of the Pethidine use is basically similar like the previous two because it's still they are in the same group in the opioid groups. However, what I want to emphasize here will be the effects of the Pethidine will cause seizures, tremors, and also it has stronger euphoria than morphine but shorter duration. And it can be less effective for long-term pain management due to toxic metabolites. So now I would like to show you the four phases of drug abuse. So for first stage, the person might try the drug like because they feel stressed, they're influenced by the peer, by their friends, so they would start to try. But in this phase, there were no dependence yet, but the person might experience pressure or relief from stress. For second stage, the person may start using the drugs in specific situations, like in the parties or when they feel really stressed. They will start to feel, oh, maybe I can try the drug again. So it can cause regular use of drug. And stage number three, the drug use start to become their habit. So they will use the drug in their daily life. The person may start justifying their use is I need it to relax, something like that. And their social, their work, their family life may start to be affected. And step number four, which is the final stage, the person starts to rely on the drugs to function normally as a person. So they will have increased tolerance and leads to higher doses. So they will start to use higher dose of the substance, and the withdrawal symptoms will appear when they attempt to quit. Next, we talked about the symptoms of drug addiction. So, according to the American Psychiatric Associations, their diagnostic and statistical manual of mental disorder, which known it as DSM-5. According to this, a person must have at least two signs from the list of symptoms here, at least over 12 months to be diagnosed with substance use disorder. So we can look at the list of symptoms here. The person with drug addiction will show intense craving, increased tolerance, loss of control, financial strain. Like all these are showing if the person fulfill at least two over 12 months, it can be diagnosed with substance use disorder. So now let's do a very quick recap. So just now we already talked about the causes of the drug abuse, which include biological factors, the psychological and the environmental factors. And then we talked about the impacts of the drug abuse on a person's health, family, and economic. And then we already go through about the definition, the example, the short-term and long-term effects of the stimulant, heroin, morphine, and pethidine. So now let's talk about the treatments and preventions on drug abuse. So treatments. First step is always detoxifications. So most of the case, patients are required to stay in hospital. At the same time, the healthcare workers, doctors, nurse will monitor the person's conditions. If needed, doctor might prescribe medication to help detox all the substance out of the body. This is called medication assisted detox (MAD). For example, charcoal or doctor will use normal salines to help the patient's body to flush out all the substance. At the same time, doctor will monitor the person's symptoms, withdrawal symptoms. If it's too severe, doctor might prescribe some low dose substance to prevent a life-threatening condition. Second one will be pharmacological treatment. For example, disulfiram. This is the medication prescribed for those person with alcohol addiction. So it can cause an immediate effect, a feeling of hangover after the alcohol consumption. So this can help the person to slowly reduce the intake of alcohol. And naltrexone is another drug which used for opioids or alcohol addictions. It can help reduce the feeling of euphoria. So slowly, we expect them to reduce the drug abuse. Third one will be the substitution therapy. So doctor might use a less potent drug for to the patients for them to slowly reduce the dose and then slowly stop using the drug. For example, is chewing gum and skin patches for those with nicotine addiction. And next one will be the support groups or peer support. So this is seems like family support. So the support from the surrounding is very important to help a person to get motivated in doing something. In this case, is withdraw from the drug. So they can give emotional encouragement, support to help the person to feel like they are not alone. They have support for for them to move on to the next step. And then rehabilitation support. So this is very important for a person to back to the normal society. So the rehabilitation support, for example, is helping them to readapt to the society, to gain back some skill, to live, to find work, or those like to socialize, or this. And then will be the psychological or counseling. So, for example, they can have the family therapy, the motivational interviewing, or contingency management. These all these are different types of psychological approach which can help a person to uh, back to the normal lifestyle. Like the contingency management is they will use reward to help a person to quit from the um, improper behavior. So in this slide, I just want to emphasize that the treatments of drug abuse is different based on the person case, based on the drug use, the duration. So it's not a one size fits all. The doctor, the psychotherapist, the psychiatrist, all of them have to really interpret, assess the patient condition, and come up with the best treatment for them. So we already talked about the treatments of the drug abuse. Now we move on to the withdrawal symptoms. So, the withdrawal symptoms can range from mild to severe. The general symptoms that we can see on stimulants withdrawal symptoms will be extreme fatigue, depression, also known as crash, which is like excessive sleeping or irritable. And then they will have increased appetite, intense drug craving. And for opioid user, they will have more severe withdrawal symptoms. They will have severe flu-like symptoms, including runny nose, chills, sweating. They will have intense muscle pain, body cramps, watery eyes, vomiting, diarrhea, dehydration, and also anxiety and restlessness. Then we move to the preventions. So there are several ways to prevent substance abuse. For first one will be education and awareness. So the related organization or government can um, organize the campaign or speech in the workplace or university, even primary school, to help public understand the effect of drug abuse and their long-term complications. And next will be healthy coping strategies. So we already know mental problems such as stress, depression, anxiety can lead to substance abuse. So we encourage the healthy stress coping management, for example, hobbies like exercise or meditation, yoga, to help them relieve their stress. Third one will be peer influence and positive friendships. So we encourage everyone to avoid the friend circles who are supporting drug abuse or who are actually using the drugs excessively. So they should avoid this kind of peer influence or peer pressure to avoid them having substance abuse together. And next one, early intervention and counseling. So if one person already addicted to certain drugs, they should seek for professionals for earlier intervention and counseling to prevent the condition go further and worse. Next will be community-based preventions. So the individuals can join in community events such as sports, clubs to build healthy connection with people. And another example here is NADA's open concept approach allows drug users to receive voluntary treatment at local community service centers without legal repercussions. So uh, the person who are using drug basically they are very afraid to disclose themselves to the counselor or therapist because they think that this thing is illegal, so they feel very afraid of it. So this program can help these individuals to start to go there and start to reform themselves. And next one, strict drug laws and policies. So every country should um, review their laws to form a strict or enforcement of drug regulations and reduce the accessibility and discourage drug related activities. Next will be strong family support. So, family as the person closest to us, the open communication to our family is can help us relieve a lot of stress. If the family can understand us better, it will cause the person less likely to engage in illegal activities. And last but not least will be take only prescribed medication. So every person should take only the prescribed amount of medications. Do not overdose, do not overuse it. So in conclusion, drug addiction remains a major issue in Malaysia. We can see from the statistics just now. And despite the effort of the government to resolve it, the widespread availability of drugs contributes to the problem. So the drug abuse can lead to physical and mental health deterioration, the social instability and legal problems, and the worst to come is cause a country to deteriorate. So preventing drug abuse requires a collective effort, which including education, family support, positive peer influence, and access to the mental health service. By promoting the public awareness and enforce the strict regulations, we can encourage a healthy coping mechanism also. Society can reduce drug abuse and its harmful effects, hopefully. And that's all from my presentation. Before I end my presentation, I would like to recite this quote from Benjamin. He say, "If you can quit for a day, you can quit for a lifetime." So that's all from me. Thank you for attention. That's all for my presentation. Thank you.